Staying healthy today, teenagers, get this, are drinking hand sanitizer to get high, and they're ending up in the hospital.
The internet is full of videos showing how to break the alcohol down from the sanitizer using another substance. Also online, video of teens taking shots of the distilled hand sanitizer. Liquid hand sanitizer is 62% ethyl alcohol. That's 120 proof. That's a lot. A bottle of vodka, keep in mind, usually about 80 proof. Now, one of these pocket-sized bottles, it's equivalent to 2 to 3 shots of alcohol, essentially.
Yeah, and that's why they're suggesting people use foam instead of some of the liquids and gels. And we've brought in Dr. Diane McCallister to talk more about this, plus spring injuries as well. But let's begin with this sanitizer. What happens when a person drinks a sanitizer containing ethyl alcohol?
Well, ethyl alcohol is ethanol, which is in all kinds of alcohol that we buy over the counter, so you get drunk. But when you look at the ingredients of the hand sanitizers, there's also propanol alcohol and other ingredients that are toxic and can ruin your kidneys, can cause coma, and so you're not drinking just ethyl alcohol, so it's dangerous.
You get all kinds of other things that you shouldn't be ingesting. But what can we do about that? I mean, a young person could walk into a convenience store or a grocery store. They could buy this, right?
Yeah, I think as parents we're just going to have to educate our children that it's a bad idea. There's other ingredients in there that are not good for them, and so they need to stay away from it.
All right, well, this is the time of year when we begin to see springtime injuries, especially in the last couple of weeks. We've been getting out more, the weather's warmer, we're encouraged to go outside. What kind of injuries are you beginning to see in your offices?
Well, as we do more outdoor sports, we're seeing sprains and strains, fractures, and then, head injuries.
Yeah.
So, from all the different sports.
And sometimes we don't know if it's a sprain or a broken bone. Is it a wives' tale that if you go to try to touch the area, like your child or something like that, they'll pull away? I mean, they know it's broken somehow?
Well, it varies based on how badly broken it is. It is usually painful over a bone that's broken. It's also painful over a sprain or a strain.
So how do you tell the difference?
Sprains and strains, generally you see they're over joints, and you get some mild swelling. You know that you've rolled your ankle or hyperextended. Fractures more often happen when you've fallen with a blow or something's hit you.
So we're bound to do some of these things as we live our lives and stay active. What can we do? What are your suggestions for relieving some of the pain?
So generally, if you think it's a sprain, ice, elevation, anti-inflammatories like ibuprofen, and then an ACE wrap to kind of help mobilize it, and it helps contain some of the swelling, are good things to do. If it's very swollen and very black and blue, you probably need to go in and get help. And definitely, if you cannot put weight on it, you need to see a doctor, because even severe sprains and strains sometimes need more medical attention.
Good topic to discuss with our kids.
Yes.
I mean, when I was a kid, my brother said, I broke my arm. I said, oh, you're being a weenie. He did.
Yeah.
And I was watching, the little brothers, and I'm the bad brother. I didn't know.
Yeah, well, there's bad moms and dads, too. We've all done it.
Okay.
But it's important to get fractures immobilized so that they heal appropriately. And it's important for people not to reduce fractures themselves, because you can injure nerves and blood vessels, and that's very dangerous.
All right. Good reminder. Thank you so much, Dr. Diane McCallister. She is the Chief Medical Officer at Centura's Porter Hospital, Adventist Hospital, and you can find her weekly advice on thedenverchannel.com. Just click on Staying Healthy.